Hello and welcome to Boom Goddess Radio. I'm Jennifer Davis Page, your host, and today our guest is Dr. Chandra Llewellyn Travis, board certified life and executive coach. Welcome, Dr. Chandra. Thank you so much for joining us today.
Thank you. It's a pleasure to be on your show.
Tell our audience why you decided to work in the professional training and coaching industry.
I originally started in psychology. Even as a young person in high school, I was very enamored with people like Joyce Brothers and Dr. Ruth, who were able to publicly address in a very general way some basic concerns that people had, but there was never a platform for many people to go to. And so I always liked that these women were professionals and helping people help themselves. So that was one thing. The other thing is I realized that in many communities, particularly of color, that there isn't any mental wellness services available that speak to people culturally and incorporate all the different aspects of their traditions and cultures and religions into their healing and wellness maintenance. So coaching afforded me that possibility. Coaching, as opposed to more of the clinical counseling and therapy, is very directed at a strength-based model, like where are your strengths, and from your strengths we build you up and help you deal with the things that need to be strengthened. And the second thing is that we don't have, so I like that orientation, and sometimes it's a quicker intervention. It is led by the person with the support of the coach.
I was fascinated by the information that I read on ACES. I mean, absolutely fascinated. I mean, this is something that I had no knowledge of. So I'd like to talk a little bit about that. Can you tell our listeners about the ACES study?
Yes, ACES study stands for the Adverse Childhood Experience Survey. It was developed in 1995 in conjunction with Kaiser Permanente and the Center for Disease Control. And what it was an extensive survey that looked at health outcomes of individuals based on the events of their lives. And when they looked at the work, they realized that health outcomes can be predicated by childhood traumas. And so I discovered this, the study was done in 1995 and by two doctors, in particular, Felidi and Anda. And then Nadine Burke-Harris took on the study in California and has been really a champion of it. Now she's a Surgeon General of California and has used this as an intervention tool to stay off the level of disease in children, hopefully, and help adults identify where some of their issues of health may lie and work with their practitioners.
Go ahead. I think we're having a little bit of a gap, but continue.
All right. So what was fascinating about me fascinating for me when I discovered this was that the people with high ACE scores had 3 times the lifetime risk of heart disease, had a 20-year difference in life expectancy, had that people with those high scores had 7 out of the 10 most fatal diseases in the United States. And not being aware of these things and how they impact us as adults or how it impacts children currently became a very important educational tool for me when I'm working with adults, either in a facilitation setting, a professional development setting, or working with clients in my practice. Some of the exposures that they're really concerned about are things like physical abuse, emotional abuse, sexual abuse, parental mental illness, substance dependence, incarceration, parental separation, divorce, domestic violence, and physical neglect. And those are very real things. And this, what I find fascinating about this study and imperative is that this information was gathered before our pandemic, before the pandemic that we're currently in. So these are already risk, and compound that in the context that all of us have been living through over this last year and change.
Now, from what I'm understanding, and please correct me if I'm wrong as we go along with our interview, I understand that the ACES study is based on the experiences of children between birth and 17. Is that correct?
Before 18, yes.
All right.
Anything that happened before you were 18, yes.
All right. So now I took the quiz. I took the ACES quiz, and my score was 0. And I had lovely parents and a lovely childhood and great siblings. So I feel very fortunate. I've always told all of my friends that having good parents is really a gift. And a lot of times we don't realize what a gift it really is to have wonderful parents. So now, all of that being said, my score being a 0, is that, I know it's a good thing, obviously. However, my question to you is, if you experience some of these 10 that are on the ACES quiz, if you experience them after 18, does that affect you?
Yes, trauma affects us at all points of our lives. The thing is, how do we deal with it? And how resilient are we? What sorts of networks and support systems do we have around us? So those are, yes, we are impacted by trauma, but I think as we mature, we've developed coping skills that we may not have developed as children. I want to go back to the questionnaire. The questionnaire, the self-administered questionnaire, which I'll share with the audience later on, it doesn't indicate all kinds of stressors or traumas that can happen in childhood. So for example, bullying, right? When we look at the news of late, all of the violence that we've seen, at the Capitol, the George Floyd incidents, the Breonna Taylor, all of those things are also traumatic events. They're not the 10 that were specified in the study and on the quiz are general and they happen often, but there are all other kinds of traumas that are not necessarily listed in there. So, but the thing that's most important is that we realize that we have to do something. In my own personal background, I think about when I was younger, some of the traumas that have happened to classmates, to neighbors, and as children, we were told to not say anything. You're not supposed to talk about your business. You're supposed to look the other way, ignore it. And what happens is we cultivate a culture of silence, which oftentimes leads to unaddressed trauma, which leads to mental health disease, mental health issues, physical disease, and just emotional instability. So these kinds of things, it's like breaking the culture of silence so that we can actually deal with being well.
I do want the quiz. I do want the quiz to be available to our listeners. So we're going to have it on our YouTube channel, and so that they can go and they can take the quiz. I don't know if that's a good thing. Do you recommend to people that they take it? And then what do they do with that information? I mean, if you end up being a 6 or a 7, what do you do with that information? I mean, if this is all brand new to you, what do you do with the information once you've taken the quiz?
One is you take it to your healthcare provider, because one of the Dr. Nadine Burke-Harris, she was a pediatrician. She is a pediatrician, and she was noticing like, we can treat, we can immunize, and we can do we can keep kids out of the hospital, but there's still this thing that's recurring. And so when doctors know, or healthcare providers know, that you've had these experiences, it helps them look into how to treat you, right? Oftentimes, doctors have been blind to the social, psychological issues that impact health. They basically look at the body. But having this information, the CDC is now working with doctors, and this has become like a national call to action. It's said that adverse child experience is one of the most unaddressed public health issues in the United States. And if we can begin to address these things, it helps people know where to look for ailment, how to work on prevention, and also how to work with their own community and children so that they are not impacted because we're not paying attention. So yes, you can take the test, but the information is to support your clinician and to give you an awareness. I want to say this too. This is not medical advice that we're giving on this program. It's a tool that may be helpful for you if you'd like to learn more about it and experience what this could be working with your healthcare practitioner.
Now, when you say healthcare practitioner, I mean, does a mother, let's just say a mother is home with her child and they hear our podcast and our radio show, and they say, okay, we've taken the test. Do we take the results to our pediatrician? Do we go to a psychologist? Where do we go? Where do we go to get help?
You could, depending on, like, you can do both, right? So you can say, first of all, to inform your pediatrician, do you know about ACEs, right? So I'll give you an example. I do a lot of professional development with youth serving organizations. And one of the biggest ones in the city here has site-based clinics in schools and in after-school programs. I was working with their directors and introduced them to the people in the workshop. Some of them were social workers by background. Some of them have the community experience and education, and they had no idea what it was. The leader of this group had a meeting and took it to all of the clinicians in their program. And now every child in their program who goes through the clinics, all right, so this is a piece of information so they could take it to teachers, they can take it to the school clinic, the school nurse, they could take it to therapists, they could take it to their physicians and pediatricians. Oftentimes people, if you help people see the people who are providing services, because how much time does a clinician really have? But if they are made aware that this is something that's important, the tool takes less than a minute to do, and they may use it. They can also use it with other patients. So it's information, and also when parents, even if they don't want to give the tool, they can look at it and think about what can I do to prevent these things from happening to my child. Right. So that's, I'm very big on prevention, and this is a prevention tool as well as an education tool.
This is excellent, even for new mothers who really don't really know, when you're a new mom, you really, you don't really know what to do. I mean, you know the basics and to be good to your child and to love them. But this is really excellent information to have for new mothers.
Absolutely. And, just like they taught us when they were teaching us about sudden infant death syndrome, before we took our babies out from the hospital, for example, or about immunizations, this can go right along with that kind of preventative education.
We're going to take a brief break, and we'll be back with Dr. Chandra in just a moment.
Did you know dragging chains can spark a wildfire?
Only you can prevent wildfires.
Welcome back to Boom Goddess Radio. This is Jennifer Davis Page, and we are continuing this wonderful conversation with Dr. Chandra Llewellyn Travis about the ACES study. Dr. Travis, continue with your conversation about ACES and your story that you were going to tell our listeners.
Yeah, so one of the I'm being a coach and a person with a psychological background and a human being, I observe, and things happen all over the place. And I was working on a project with the college, and I live in New York City, and I gotten out of the subway about the time that schools let out. And the normal way that I would walk to where I was going had been cordoned off, and there were like police, it was like a police barrier there, and a lot of kids, and a lot of people just looking and looking. And I said, "What's going on?" And they said, and then I started hearing, "Jump, jump, jump." And I said, "What is going on?" And it was someone trying to commit suicide on the top of a building, and they were trying to prevent that from falling. And there were men with their little kids there. And I said to one person, I said, this child, she was like 4 or 5, shouldn't be looking at this. And the jumping was just, just even people calling out like, "Jump, jump," like, "You feel like doing this to yourself, go ahead." What are we doing with ourselves when we think it's okay to let someone's mental illness be some sort of vicarious entertainment? And the second part, for the little girl, the young man said, "Well, this is not my child. I'm holding this person for her father. Her father is over there." So I go over and talk to the father and said, "Listen, this is what I do for work. And this is very concerning, and your daughter's very small. This is not a good thing for her to see. Don't tell me what to do with my kid. This is life. This is life. She got to see it anyway." And she got to see, gonna be dead people all the time. She got to see it anyway. And I was just like, wow. This is what you want to teach your child at 4 years old? And I said, we have developed such an appetite for violence and apathy towards mental illness that we don't know that it's not okay. We look at TV, the news, the appetite for violence in media, social media is so strong that it's almost anesthetized us to the possibilities of like creating another kind of world where we don't have to overexpose ourselves. It's bad enough the way it is. We don't need to overexpose ourselves. And this story of this little girl and these people going, "Jump, jump, jump." And the father says she needs to see this, was so distressing to me. And I said to myself, there has to be a better way. So part of my work and why I chose to use this topic as opposed to some other topics I could have taught, because I think people just don't realize how children are standing in the wings, being traumatized in silence. And they don't realize that over time, this can actually have a very deleterious effect on their body as well as their mind and spirit. And so this is why I've been very passionate about this particular topic.
How are you going about spreading the word? I mean, tell us what you're doing to spread the word on ACES, and and where are you going? I mean, I know you're going to schools, but where else are you going to spread this important information?
I work a lot with faith-based organizations as well. And oftentimes, faith-based organizations, particularly now, are beginning to understand the value of mental health, and that you can pray and receive services. That oftentimes these tools are, what I like about tools like this, you can take it yourself. No one has to see you taking it to become aware. What happens is sometimes when you have to go somewhere and take something or be labeled something, people won't go. But if people can do it in their own privacy or learn about it or talk about it in a general forum, then it's easier for them to take in information, and it's up to them to determine what they want to do with it. But so I use these types of platforms if I'm doing group coaching in a school, if I'm doing professional development with people who work with children and families, if I'm working with faith leaders and congregations, this is a way that I do it.
So that being said, do ministers, if I'm calling them, saying parishioners or members of the church, if they take the test and then are the ministers trained to speak with them, or are they trained just to direct them to their physicians? Tell me how do you talk to the ministers?
Well, so it's up to the person's taking it and whether or not they want to share it, right?
Right.
But the trick is to always provide information and follow-up resources. If you want to learn more, if you want to go online and look at this particular organization or hospital have these type of services. So it's not just giving the questionnaire, but giving resources for people who wish to follow up. The information that will be provided for the link will have a series of links that people can actually click onto and discover more things about ACEs and where they can go for help.
Excellent. Let's talk a little bit about some more about ACEs and the scores. Do you want to talk to our audience about some of the questions on the quiz?
Yes. What I'm going to do is I'm going to share with you a quiz. Just going to pull it up. And I want to say this to begin with. Your score is not a death sentence. All right. Your score is information that you can use to look at yourself, to think about where you want to make interventions if you need to. You can use that information to share it with your clinician or your wellness provider. And it's not medical advice. We're sharing, this is just education for what is known. Now, I wanted to say there's some questions on the survey that are sensitive. So please note that if you have any of those like sensitivities, you may want to turn off from the program or mute it for a few minutes, right? So I'm going to share the survey from ACES Aware, which is based out of California, and it's working with the Surgeon General's office there. So I like the survey, and it's online available at acesaware.org. So the questions are, you will be giving 10 categories of adverse childhood experiences. Now, the original survey had far more questions than these 10. And from the list below, please indicate which category of an experience have you had before your 18th birthday. And then when you're done, add up your total number, all right? The first question is, did you feel that you did not have enough to eat, had to wear dirty clothes, or had no one to protect or take care of you? Yes or no? Second question, did you lose a parent through divorce, abandonment, death, or some other reason? Did you live with anyone who was depressed, mentally ill, or attempted suicide? Did you live with anyone who had a problem with drinking or using drugs, including prescription drugs? Did your parents or adults in your home ever hit, punch, beat, or threaten harm to each other? Did you live with anyone who went to jail or prison? Did a parent or adult in your home ever swear at you, insult you, or put you down? Did a parent or adult in your home ever hit, beat, kick, or physically hurt you in any way? Did you feel that no one in your family loved you or thought you were special? Last question. Did you experience unwanted sexual contact, such as fondling or oral, anal, vaginal intercourse or penetration? So those are the questions. And you would now make a total of your score. So in the data, scores that are 4 or more have significantly higher percentages of health risk, including things like hepatitis, depression, lung cancer, heart disease, COPD, suicidality. And so knowing what those scores are and knowing that maybe I do have a high score and maybe I feel a little blue sometimes, let me get some help. Let me get some help. Or let me make sure my doctor's checking for these things when I go for my physical, right? Because sometimes they don't check for what we don't ask them to check for, or we don't go if we don't know what to look out for. So this is one of the reasons why I want to share this with the audience. But the upside of this too is that when we become very conscious of this, the ACEs, we can actually start doing things to prevent ACEs from and reduce the number of adults over time. So it's believed that if we could get below that 4 in ACEs, we can lower depression by 44%, as much as 44% in the adult population. We can decrease 2.1 million cases of depression. We can decrease about 1.9 million heart disease in adults and 2.5 million people who are overweight or obese. All of those factors are some of the most critical health factors that we have in our country. And so this is a public health issue, but it's something that people are not looking at because the residuals happen in adulthood, but the prevention can happen in childhood. And I want to say this before I close up. Resiliency is the antidote to ACEs, and we'll talk about resiliency a little bit later on.
You sent me a wonderful TED Talk that was given by Dr. Nadine Burke-Harris. So I would like to encourage our listeners to go to TED.com and look for Dr. Nadine Burke-Harris. Over 8.5 million views on her TED Talk on ACEs. So I thank you, Dr. Llewellyn, for sending that to me. That was very informative, and I'm hoping that our listeners will go and take a listen as well. We have about 30 seconds left, and we're going to have part 2 of this amazing series. Next week, Dr. Chandra will be speaking about resiliency. That seems to be the next big topic. And I thank you very much, all of my Boom Goddess listeners, for joining us today. And Dr. Llewellyn will be with us next week, and we'll be talking about resilience. Thank you for tuning in.